So I will talk about epidemiology, and epidemiology is a science or a discipline which is connecting, and my task here is to give some unexpected connections. So what I'm going to do is connect cocaine use with air pollution, with newborns, with tobacco control, heart disease and placental tissue. So if we look to the aging process and the simplification, what is happening is given in this slide. It shows that we are becoming more vulnerable during lifespan. And some people are more vulnerable early in life, while others are less vulnerable from the beginning of life. And then you see these peaks going up and down, and this is what we call triggers or onset factors. These onset factors, they make us from the one moment to the other more susceptible for getting a disease. In reality, what does this mean? The lines that goes up, these are processes that are going very slowly, such as plaque formation in our arteries. Well, the peaks up and down are onset factors or triggers that make us more susceptible, and which makes that such a plaque can erupt, as an example, for cardiovascular disease. So what are these factors? This can be alcohol use, this can be heavy meals, this can be factors which are actually very not harmful for healthy people, but become more dangerous or can trigger an event at a higher age, and air pollution is one of these. So I will focus on the cardiovascular aspects of air pollution, both on these trigger aspects and the chronic aspects. Let's first look to the chronic aspects. And now epidemiologists do not work with mice normally, but of course it's important to feed our research also from animal science. And this is a very nice study showing mice exposed to either controlled air or during 6 months to polluted air with small dust particles. And what you see is clearly the higher plaque formation which is visible in the polluted or the mice that were inhaling the air pollution. So if we want to translate this to the population, we have to follow up people, and we look here to patients with diabetes, because patients with diabetes are more susceptible for developing cardiovascular disease. And so we look to the effects of air pollution in this group, and we measured the carbon load in lung in airway macrophages. So this is a personal exposure. People inhale salt solution so that we can collect the lung cells. We visualize these lung cells, and then we can account for the exposure to air pollution. And you see that people with higher exposure have here an higher oxidized LDL, and the oxidized LDL is a marker for atherosclerotic formation. So you see here what's visible in experimental studies can be visualized and is clearly confirmed in also animal studies, or sorry, in human studies. So let's now move to the acute effects. So the trigger effects, the effects that might are not important early in life, but in susceptible people, these onset factors might become important. And we have different factors that we have. We can expose to coffee, physical exertion, stress events, air pollution, cocaine use, and so on. These are all trigger factors. But what I want to demonstrate here with this slide is the extremes. And that's also that we should think in epidemiology not only at an individual level, but certainly at the population level, which can be totally different in risk perception. Physicians in general, and they should be, they are trained to judge individual risk. They have to treat their patients. But if we need to translate risks into the population and make public health advice, it cannot be solely looking to the individual risk. We should also look to the, what here stands, PAF, the population attributable fraction. And I'm going to demonstrate this concept by looking to the extreme. So on the one hand you see cocaine use, and this is the individual risk on this x-axis. So what does this mean? This 24 means that around cocaine use, a person at about 24 times higher risk to get a myocardial infarction. If we go down to the left of the slide, air pollution, this gives about an increase in the risk with about 1.05. So almost negligible if you compare it to cocaine use. However, if we are going to translate risks to the population level, how important are they at the population? How much of the heart attacks at the population are triggered by these factors? You see that air pollution becomes important and with about a risk or 5.5% of the heart attacks in the population can be explained by air pollution, while cocaine use accounts for less than 0.5%. So this means that even small risks, but if the prevalence of the exposure is common in the population, they can really attribute to the public health significance. So unexpected connections, already mentioned that cardiovascular aspects are important for air pollution. Let's now also connect with newborns and elderly. And one of the important things that in the population is also exposed to is tobacco smoke, and I show here Richard Toll. Richard Toll is the first person that really demonstrated in well-designed epidemiological studies that smoking causes lung cancer. He followed up 35,000 British doctors during more than 50 years and demonstrated a lot of health outcomes of smoking. We know that the acceptance rate of smoking is much lower than previously. We had, for instance, in the 60s, you could even, you had doctors that smoked during consultations. Of course, this is not acceptable anymore. And so in the society, the degree of acceptance to exposure to tobacco smoke decreased a lot. And in this, one of the reasons that this decreased so much is that we have the implementation of smoking ban legislation. Important legislation which was well started in Europe and Northern America. Most countries in Western societies have implemented some smoking legislation, such as no smoking at work, and also legislation on restaurants and pubs. So what we know from this smoking legislation is that the acceptance rate to tobacco exposure in the population decreases, and here we show some benefits of the NLA legislation on population health. We look to preterm birth as an important outcome. We see in Belgium there was a prevalence of preterm birth about 7.4%, and after the introduction of the legislation, this drops. Of course, I can imagine that some people think, yeah, but how can you connect this? Is this an unexpected connection, or is this a real connection? And can you just connect such a thing from such a figure? Of course, we have to look for alternatives. Maybe other things changed. Maybe the age of a first women get its first child changed during this period, or therapeutical changes could be observed. However, we took into account a lot of variables that might explain this, and you see consistently every time the smoking legislation was introduced, which is stepwise introduced in Belgium, we see that there's a drop with about 3% in the preterm birth rates. Importantly in such a research is, of course, that you can also confirm it in other studies. If it's so only shown in one country with such implementation, this is not enough. We need to confirm this, and other studies are now worldwide observing the same tendency. For instance, here I'm showing Scottish data after the smoking ban legislation, which was immediately there, not stepwise, but immediately at work, restaurants and pubs introduced. The investigators found a decrease with 11%. So important health benefits due to smoking ban legislation and less exposure to a personal form of air pollution in the population. So finally, can we also find molecular targets explaining all these effects already from early life on? And so we look to mitochondria. Mitochondria are the energy producers of cells, and during the first 9 months of life, the placenta is the important organ where all these starting processes of a new human being are occurring. So we look to air pollution again in mothers, and we recruited newborn and mother pairs. We look to the mitochondrial DNA content in the placenta, and then you see that with air pollution, which is given here, there is a decrease in the mitochondrial DNA content, the function of the mitochondria, the function of the energy-producing organelle of the placenta is decreasing with higher concentrations. As with air pollution, and connect this also again with tobacco smoke, you see that in smokers also the energy production by the mitochondria, reflected by the mitochondrial DNA content, is decreased. So important molecular targets that can be explained this observation as well. So, summarizing the unexpected connections. So the cardiovascular system is a primary target. Small individual risks might become important at a community level if the prevalence of the exposure is high. And we have seen that in a lot of countries with smoking ban legislation, that it's beneficial for population health. Still, 84% of the worldwide population is not protected by this legislation, and data show that this should be. And finally, all the observations made in epidemiological studies, there is a connection early in life, and you can find footprints in the placenta of exposure to air pollution and tobacco smoke. Thank you.